A covered California bus tour made a stop in San Diego this morning to spread the word. The open enrollment period to sign up for health insurance begins Saturday.
But while the number of uninsured has shrunk by 3.4 million, many remain uninsured, especially Latinos. KUSI Steve Bosch is here with more on the story. Steve?
Alan, Sandra, the federal exchanges have reduced their expectation for the enrollment by millions. But California's exchange expects to increase by 500,000. Covered California anticipates a total enrollment of 1.7 million by the end of this enrollment period in February. There was no question San Diego would be a stop on this spread the word bus tour.
California led the nation, and San Diego is leading California because of what this community is doing coming together.
This bus tour is part of the $95 million being spent on advertising. Because many people remain unaware, they can get health coverage and have the government pay for most or all of their premiums. Of the 1.2 million already enrolled, 90% are getting government subsidies.
We know that there are still over 1 million people in California who qualify for subsidized care who have not signed up for insurance. Over 600,000 of those are Latino.
Here in San Diego County alone, more than 240,000 of your neighbors, of those who are in your churches and your schools, are eligible for coverage and are walking around uninsured.
For Covered California, most everybody has to be insured to make the system viable. The selling point seems to be the subsidy. For example, the director of Covered California, Peter Lee, said one of the TV ads is about a woman from Hayward.
But she's making it on her own, could not afford health care. Through Covered California, she has health insurance that she's paying $12 a month for. When she goes to see the doctor, she has a $3 office visit copay.
But for those able to buy insurance on Covered California, the copays have skyrocketed, the premiums have gone up, and your out-of-pocket is $5,000 before the insurance kicks in.
As premiums go up, so goes the subsidies, which means the taxpayers are footing a bigger and bigger bill. The question will be, how does that work compared to the original model of cost to the federal government? And will there be enough in the kitty on federal taxes, or will there have to be increased taxes to pay for that?
And one other thing, for those already in Covered California, don't automatically renew your policy. Plans change, and so do doctors.
Make sure your doctor is in the network. That's one of the biggest things, because HealthNet just announced that the PPO plans in Covered California and outside of Covered California are going to be gone January 1.
Now, on top of that, the doctor's list on the website remains inaccurate, and many people choose a health plan because they want to keep their doctor.
So what is Covered California doing about that doctor's list right now?
Well, Ellen, they're not doing a whole lot. Peter Lee says the health plans were kind of messed up last year, but he says they're getting better at it, and it's working better. But when asked if he would guarantee that the doctors who are in these health networks could be displayed on the website as like a pop-up, he said no. So we'll see how it goes. Had problems last year, we'll probably have some problems this year. I think mostly because the computers, all of them can't talk to each other yet.
Still some kinks in the system now.
Yeah.
All right.
Thank you, Steve.
Yeah.